Arterial blood pressure is defined as lateral pressure exerted by column of blood on wall of arteries. Systolic blood pressure is defined as maximum pressure exerted in the arteries during systole of a heart, and it ranges between 100 to 140 millimeters of mercury. And diastolic pressure is a minimum pressure exerted in arteries during the diastole of heart. That is, normally it is between 90 to 60 mm of mercury. Pulse pressure is the difference between systolic and diastolic blood pressure, and average being 50 milligrams 50 mm of mercury, and mean arterial blood pressure is the average pressure throughout the cardiac cycle. So mean arterial pressure can be given as diastolic blood pressure plus one-third of the pulse pressure, because the systole and diastole, they are not same. Factors affecting blood pressure. Age. Both systolic blood pressure and diastolic blood pressure increases with age. Systolic blood pressure increases more than diastolic due to decreased distensibility of arteries. The diastolic blood pressure decreases with age after 50 to 60 years. In females before menopause, systolic blood pressure is 4 to 5 mmHg less than the males of the same age. In females after menopause, systolic blood pressure is 4 to 5 Hg more than males. This effect is due to estrogen, which prevents atherosclerosis. In obese individuals, brachial arterial pressure gives high readings because there is more tissue in between cuff and artery. Exposure to cold climate via hypothalamus produces vasoconstriction and increases both systolic and diastolic blood pressure. Exposure to warmth via hypothalamus produces vasodilatation and decreases both systolic and diastolic blood pressure. There can be diurnal variation. 5 to 10 mm of mercury is common in with the systolic blood pressure. Peak values observed during afternoon and lowest during early hours of morning. Reverse rhythm is observed in night workers. The blood pressure comes back to normal 5 minutes after the stoppage of exercise due to the relaxation of muscles, which produces vasodilatation. The initial increase is due to the sympathetic vasoconstriction. Excitement, fear, worry increase systolic blood pressure due to increase in cardiac output secondary to increased sympathetic activity. Gravity also plays important role. Pressure in any vessels below the heart is increased by the effect of gravity. Pressure in any vessel above the heart is decreased by the effect of gravity. The magnitude of gravitational effect at the normal density of blood pressure is 0.77 mm of mercury per centimeter vertical distance from heart. Familial tendencies of hypertension with the systolic blood pressure are common. Change in males, the changes in the systemic blood pressure occurs because of the pressure over the heart due to the distended abdomen, which increases the heart rate and increase epinephrine release from adrenal medulla. Therefore, SBP increases by 5 to 6 mm of mercury up to 1 hour after meals, and diastolic blood pressure remains the same or may decrease slightly due to the vasodilatation in digestive organs. Systolic blood pressure falls in early hours of sleep by 15 to 30 mm of mercury because of general vasodilatation of vessels in complete relaxed state. However, disturbed sleep increases systolic blood pressure due to the increased sympathetic discharge secondary to skeletal muscle tension. Posture. Changes in the diastolic blood pressure are more with a change in body posture. In standing posture, diastolic blood pressure increases, and in sitting remains normal and decreases in lying down posture. Upon standing, there will be peripheral pooling of the blood in the dependent parts that decreases venous return, decreases cardiac output, decreases systolic blood pressure, and later the decrease in the baroreceptor discharge increases the diastolic blood pressure. It also increases peripheral resistance, that increases the diastolic blood pressure. Therefore, sudden standing increases the diastolic blood pressure if recorded within 30 to 60 seconds of change in the posture. After that, it comes to normal via operation of baroreceptor reflexes. Coming to factors determining blood pressure. The blood pressure can be given as cardiac output into peripheral resistance. The pumping action of the heart is the main factor for controlling cardiac output. Therefore, alteration of cardiac output will alter the arterial blood pressure. And cardiac output can be given as stroke volume into heart rate. The systolic pressure depends mainly upon stroke volume, and stroke volume in turn depends on preload, afterload, and contractility. Role of peripheral resistance. This is important factor which maintains diastolic blood pressure. Peripheral resistance can be given into 8 nu L divided by pi r to the power of 4, where mu is viscosity of the blood and L is the length of the vessel and r is radius of the vessel. Peripheral resistance depends on viscosity of the blood, and arterial pressure is directly proportional to the viscosity of the blood. When viscosity of the blood is more, the fractional resistance is more, and this increases the blood pressure. Radius of the vessel. Peripheral resistance is inversely proportional to fourth power of the radius. Even a slight change in diameter can produce a great change in peripheral resistance. Changes in diameter is brought about by changes in sympathetic tone. Elasticity of the vessel wall. Blood pressure is inversely related to the elasticity of blood vessel. It is due to the elastic properties the arteries can dilate and accommodate a considerable amount of blood with a relative rise in blood pressure. At lower pressure, that is less than 30 to 40 mm of mercury, elasticity does not come to play and blood vessels behave like a rigid tube. Velocity of blood flow. The greater the velocity of the flow in a vessel, lower the lateral pressure distending its walls, according to the Bernoulli's principle. When a vessel is narrowed, the velocity of flow in the narrowed portion increases and the distending pressure decreases. Coming to the regulation of blood pressure. Determinants can fix the level of blood pressure, but when there is a fluctuation, it is brought back to the normal levels by various mechanisms available in our body. In short, all blood pressure regulatory mechanisms are grouped under short-term regulatory mechanisms, intermediate regulatory mechanisms, and long-term regulatory mechanisms. Short-term regulatory mechanisms which act within seconds to minutes. The short-term regulation of nervous regulation is rapid among all the mechanisms involved in the regulation of blood pressure. The autonomic nervous system participate in the short-term regulation through different reflex mechanisms. They include baroreceptor reflexes, chemoreceptor reflexes, and Cushing reflex. Baroreceptor reflexes, which is also called as synoaortic reflex. Receptors are mechanoreceptors and respond to pressure changes or stretch. They are free nerve endings and are located in the carotid sinus and arch of aorta. They are also located in subclavian and other major arteries. These receptors are stimulated when blood pressure changes between 90 to 150 millimeters of mercury. Baroreceptors of carotid sinus are supplied by Herring's nerve, which is a branch of glossopharyngeal nerve. Baroreceptors of arch of aorta are supplied by aortic branch of vagus nerve. When there is a rise in blood pressure, baroreceptors are stimulated. The nerve fibers from baroreceptors end in nucleus tractus solitarius of same side and opposite side. Neurotransmitter released here is glutamate. Neurons originating from nucleus tractus solitarius and these neurons end in depressor area. The neurotransmitter released here is excitatory, that is glutamate, and these stimulate the neurons of depressor area, and the neurons originating from the depressed area depressor area end in the pressor area. Here the neurotransmitter released is GABA, which is inhibitory. So when depressor area is stimulated, pressor area is inhibited. From the pressor area, fibers are given to intermediolateral horn. Impulse transmission to the spinal sympathetic center is thus inhibited. Inhibition of the pressor area reduces the normal sympathetic vasoconstrictor tone, leading to vasodilatation. When nucleus tactus solitarius is stimulated, impulses are also given to nucleus ambiguus and dorsal motor neuron of vagus. That will lead to stimulation of vagus. When there is rise in blood pressure, there is increased parasympathetic and decreased sympathetic stimulation. The suppressor of vasoconstrictor area reduces the vasomotor tone, that is sympathetic tone. When vasomotor tone is reduced, there is vasodilatation, which in turn leads to reduction in peripheral resistance. The simultaneous excitation of cardiac inhibitory center reduces the heart rate and force of contraction, causing reduction of cardiac output. So this is what is going to happen when there is an increase in the blood pressure. The baroreceptors are stimulated and impulses via 9th and 10th nerve brought to the nucleus tactus solitarius. From there it causes the inhibition of vasoconstrictor area and stimulation of cardiac inhibitory centers, which causes ultimately dilatation of the blood vessels, bradycardia, and reduction in the cardiac output, which normalizes the blood pressure. Both the factors, that is reduced peripheral resistance and reduced cardiac output, ultimately decreases arterial blood pressure. As the baroreceptor mechanism acts against the rise in arterial blood pressure, it is called pressure buffer mechanism, and the nerves from baroreceptors are called as buffer nerves. When blood pressure decreases, all the changes are reversed. Other reflexes. Atrial stretch receptors, when stimulated, will lead to fall in blood pressure. Similarly, left ventricular atrial receptors, when stimulated, lead to fall in blood pressure. Bainbridge reflex also have a role in regulation of blood pressure, but its main effect is on the heart rate. Chemoreceptor reflex. They give response to change in chemical constituents of blood. The receptors are carotid body and aortic body. They respond to hypoxia, hypercapnia, and acidosis. When the mean pressure falls, it produces lack of oxygen, excess of carbon dioxide, and hydrogen ion concentration. When the arterial pressure falls below 80 mm of mercury, chemoreceptors are stimulated. The chemoreceptors in the carotid body are supplied by glossopharyngeal, and those in the aortic body by vagal nerve fibers. The impulses reaches the medullary center, resulting in increased heart rate and blood pressure. Cushing's reflex. This response is also called as CNS ischemic response, as this reflex is due to the ischemia of brain. The mechanism is given under the factors influencing the vasomotor center and cardiac inhibitory centers. That is, so whenever the increased intracranial tension increases, whenever there is an increased pressure in the cerebrospinal fluid, it is going to compress the brain and arteries, and it cuts off the brain blood supply. That is going to lead to CNS ischemic response, and so cardio vasomotor center are directly stimulated by hypoxia, and which tries to increase the blood pressure. Intermediate regulatory mechanism, which happens within minutes to hours. They include stress relaxation of vasculature and capillary fluid shift mechanisms. Stress relaxation of vasculature. Whenever the smooth muscle is stretched for a prolonged time, it goes into relaxation, and reverse changes takes place when blood pressure falls. Whereas capillary fluid shift mechanism occurs whenever there is an increase in blood pressure more fluid is filtered through the capillary wall into the interstitial space. So blood volume decreases, resulting in decreased blood pressure. Reverse changes takes place when blood pressure falls. Coming to long-term regulation, which occurs within hours to days, all the mechanisms that tend to alter the blood volume participate in the long-term regulation. The kidneys plays an important role in the long-term regulation of blood pressure. These mechanisms include renin-angiotensin mechanism, renal body fluid system, and hormonal mechanism. Renin-angiotensin mechanism. Whenever there is a fall in blood pressure, there is a decrease in the blood flow to the kidney. This results in release of renin from juxtaglomerular cells. It converts angiotensinogen to angiotensin 1, and this is converted into angiotensin 2 by angiotensin converting enzymes in the lungs. Angiotensin 2 acts to restore the blood pressure by directly acting on the kidneys to cause salt and water retention, and also by vasoconstriction, and it also causes adrenal glands to secrete aldosterone, and aldosterone in turn increases salt and water reabsorption by the kidney tubules. All these ultimately lead to restoration of blood pressure. Renal body fluid system, that is by regulating the ECF volume. When the body contains too much of extracellular fluid, the blood volume and arterial pressure rise. This rising pressure in turn has direct effect to cause the kidney to excrete excess of extracellular fluid, thus returning the pressure back to the normal. Even slight increase in blood pressure can double water excretion, which is called as pressure diuresis. Elevated blood pressure can also lead to sodium excretion, which is called as pressure natriuresis. The reverse changes takes place when blood pressure falls. Hormonal mechanism. Hormones other than angiotensin also aids in the regulation of blood pressure. That is aldosterone. It causes retention of water and sodium, thereby increases extracellular fluid volume, leading to increase in blood pressure. ADH, which is also called as vasopressin, whenever there is a fall in blood pressure, it increases the production of ADH, and it increases the reabsorption of water from the renal tubules and collecting duct. The ADH can also cause constriction of vascular smooth muscles. Atrial natriuretic peptide, that is ANP, also causes dilatation of the blood vessels, and they tend to decrease the blood pressure. Catecholamines released from the adrenal medulla, they act mainly on heart, and norepinephrine acts on the blood vessels. Urotensin 2 present in the cardiac and vascular tissue, it is one of the most potent vasoconstrictor. Thyroid hormones help in regulation of blood pressure mainly by their effect on metabolism. And metabolism increases the vasodilatation. They also potentiate the effect of catecholamines on the vascular smooth muscle and heart. So usually in hyperthyroidism, there will be increase in the blood pressure, whereas in hypothyroidism,